Okay, so we're going to talk about IMS. What is it? What's it good for? How does it work? What conditions does it treat? Is it safe? How does it feel? And how can we incorporate that into your treatment plan? What is IMS? It's just the use of a small filament needle. We're going to tap into a muscle and we're looking for kind of a reset from that. So we want to reset your pain, your tension, your mobility, and your strength or control of that given muscle. A good example to kind of share how that really works is from a client of mine who had hurt his hamstring sprinting. And so about 1.5 years after his injury, in spite of having done quite a bit of things like massage, strengthening, stretching, he still had a lot of tension and he still had some range of motion limitations. When we were assessing him, we noticed that it felt like there was a big ball of scar tissue, or just like a really tight mass of muscle right there in the middle of his leg, something he was really familiar with for all that time. And so what we did is we basically just tapped some needles right into that tight ball of muscle. We got some twitches during that process. It felt pretty achy. And then we took the needle and tapped it into a couple of points around the low back where the muscles were also pretty tight and putting pressure on the nerve that goes to that hamstring area. And so this is typical of how we do treatment with IMS. We're always looking at that spinal level as well as the local muscle. So if we're, for example, treating at the shoulder for the rotator cuff, we're going to do something locally around the rotator cuff muscles, and we're probably going to do something to take some pressure off at the neck as well. There are times when I will say, oh, that's a good one, and at the same time as the client says, oh, that was a bad one. So yeah, really like how it feels is it's an achy sort of sensation. You'd be surprised, more achy than sharp. We like to describe it like it's a good ache, kind of like you would expect from a deep tissue massage where you're getting that kind of achy feeling, but you associate it with relief. That's how we know that we're getting a good spot. As well as, you know, we're often going to notice that kind of twitchy sensation when we get right onto a trigger point, a really tight part of that muscle, tap the needle. As soon as it touches that muscle, it'll cause a little twitch. And yeah, so that's a really interesting part that takes a little getting used to sometimes for some people. So yes, it's safe. We do use sterile needles. We're trained with where to put them. And you know, for individuals coming in, there may be some specific questions. For example, we wouldn't necessarily recommend it if you have extreme needle anxiety. We wouldn't recommend it if you're pregnant, and a number of other conditions that may be related to your personal medical kind of history and situation. So you want to make sure that you're kind of talking over that stuff with your clinician. How can we incorporate this into your treatment? You know, this is just going to be one part of your overall treatment plan. IMS is great, but it's not everything. So we're going to do some manual therapy, we're going to do some exercise, some stretching, and this is often as well where we'll be collaborating. So we'll have our massage therapists, our chiropractors, sending people over saying, hey, you know, I've been working with this person, I've been trying to release a whole bunch of tension, and this one area is just not letting go, let's try some IMS. Or, you know, with our chiropractor saying, hey, like, I've been trying to kind of manipulate this joint, trying to get this to release. The muscles are just so tight and guarding, I can't seem to quite access that comfortably. So let's do the IMS first and then come back and have a go at getting that joint to release. So this is how some of the examples of how we use IMS, and hopefully it can help you too.